why don't we all just take the highest possible dose of this medicine and go like full pedal to the metal?
Are we like thinking of your body as a sports car here?
Yes, exactly, like a foreign vehicle designed to win. What's up, everybody? I'm JC Mendoza. Welcome to Uncomfortable Questions, where I get to ask a doctor questions we're all dying to know about, but might be a little bit too embarrassed to ask. And with me today, as always, is the one and only Dr. Peter Stahl. He is a board-certified urologist and a nationally recognized leader in men's sexual medicine. I have a lot of questions about like dosages, right? Especially for some of the more common treatments of erectile dysfunction and premature ejaculation and low libido and stuff like that.
All right, let's get into it. So you got 20, 25, 50, and 100 for sildenafil.
Gotcha.
All right, the best way to think about these doses is like, what's the low dose, what's the high dose, what's the middle dose?
Right.
Because it gets confusing because tadalafil, which works about as well as sildenafil with some important differences, is 5, 10, or 20 milligrams.
That's much lower.
So like people are like, oh man, give me the 100,
Yeah.
you know? But 100 of sildenafil is very similar to 20 milligrams of tadalafil. So let's focus on like each drug at a time, right? So we talked a little bit about sildenafil.
Right.
So what do you start at, right? So most people start at 50 milligrams.
Okay.
That's like the middle dose, and that is good for most people.
Okay.
You gotta take it right, which means knowing how the timing works. So that means you take it about 1 to 2 hours before sexual activity, so you catch that peak where the drug levels are at the highest, right? And that you also, with sildenafil, it's important actually to take it on an empty stomach because you lose about 30% of the medicine and it takes an extra hour to kick in if you have food, especially a high-fat meal in your stomach when you take it. So most people with sildenafil start at 50, and then if it doesn't work well enough, you can go up to 100. If it works well but you have side effects at 50, you can go down to 25.
Got you. That's for sildenafil.
Yeah, so let's talk about tadalafil. Tadalafil is a little bit more complicated because there's actually 2 different ways you can take it.
Really?
Yeah, most people think of ED meds as, I know I'm gonna have sex,
Yeah.
I'm gonna take that medicine.
Right.
Like, because I'm pretty sure I'm gonna have sex in the next couple of hours.
Yeah.
Tadalafil works like that too, but because tadalafil lasts really long, it's much slower for your body to get rid of it. You can also take drugs that last a long time every day. That's how like most drugs are designed, right?
Really?
And when you take tadalafil every day, after about 3 to 5 days, it builds up to a level that is 1.6 times whatever dose you're taking every day. So you're taking 5 milligrams a day, it's about equal to an 8 milligram on-demand dose.
Okay.
But what's nice about that is you're not like in the bar or on your date excusing yourself to take your medicine.
Excuse me real quick, just look, what's that over there? And then
Right,
go take
that
it.
whole dynamic isn't there. And for a lot of people, that's really important. You know, they want to make this part of their daily routine so that they're ready 24/7, and there's like a degree of spontaneity that just feels like a lot more normal.
And also, if you take it every day, does that mean you're gonna be hard all the time? Or?
No, really important point, glad you asked that. These medicines don't just like, boom, result in an erection.
Oh, okay.
What they do is make your body more responsive to arousal and stimulation. Kind of like turning back the clock to when you're 18 years old.
Oh, I remember that. What was that like for you at 18?
It's a long time ago, man.
It was a long time. I mean, it was
pretty good.
I remember like it was yesterday. I'll just be walking around, catch a breeze, and be like, oh, I'm aroused.
Yeah.
And that's a little bit more difficult now, but I'm glad that I had you to talk us through that. So you're a medical professional, obviously. What kinds of things do you and other medical providers take into account when they are deciding your dosage?
Oh yeah, it's a great question, right? So there's a lot to think about. And that's why it's so important to actually deal with a healthcare provider to help you make these decisions. But what I think about is how severe is somebody's baseline erectile dysfunction? What are their other medical conditions? What other medicines are they taking that might interact with these drugs? And what is the likelihood of success based on the actual cause of someone's ED?
Right.
And then you think about things like age too a little bit. So like older people, people with kidney problems, people with liver disease, usually you can't start with a really, really high dose,
right?
Because there's a risk of side effects and dizziness, stuff like that. Younger people is really interesting though, because a lot of doctors, especially doctors that aren't focused on treating people with sexual problems,
right,
have an instinct that let's give a little dose to the 25 or 30-year-old guy with psychogenic erectile dysfunction. And being cautious is great as a doctor, and I understand what they're thinking. They're like, this guy probably doesn't have an underlying physical cause. His blood flow is fine, his nerves are fine.
He's young, he'll be fine.
But in my experience, it's kind of the opposite there, where the adrenaline and anxiety can be so overwhelming in that case, when someone has really bad psychogenic erectile dysfunction, that, a low dose might not be enough to overcome that.
If these dosages are working for people, and even if sometimes you tend to prescribe a little bit more for people who are young and other doctors might think they might not need it, why not just give everybody the highest dosage, and go full pedal to the metal on it?
The reason is because there's always a downside to everything, right? This is a really you're weighing the probability of an effective treatment outcome with the probability of a side effect. So for somebody who's not too worried about their ED, who has mild erectile dysfunction, maybe their penis is hard enough for sex but not fully hard.
Right.
For that person, a smaller boost might be all they need.
Yeah, for sure.
And if that boost can come without a terrible headache or feeling super hot and flushed, there's a benefit to that, right?
Sure.
So you got to think about the, ultimately you have to personalize treatment recommendations. As a doctor, my job is to figure out what's the right prescription for you that's going to give you the effect you want and minimize the chance of side effects that might get in the way.
If you want to skip a few doses or double up, is that something that you do have the flexibility to do?
Skipping doses when you're on a daily medicine like tadalafil isn't a great idea, because you go back to zero, then you got to rev back up to baseline, which can take up to 5 days. And doubling up might really be dangerous. You can't do anything that your doctor didn't tell you you can do.
Yeah, so even with good intentions, too much of a good thing might be a bad thing.
Yeah, I think that's one way to think about it.
All right, so Dr. Pete, I'm not gonna lie. We get this question all the time from all over the place. And I know personally because I've myself have typed it in a bunch of times. But me and everybody else, we wanna know, can you actually overdose on sildenafil?
Yeah, it's a good question. And the answer is yes. Yeah, you can. I mean, fortunately, sildenafil and the other PDE5 inhibitors, which are these ED meds, are pretty safe, and it's hard to take a lethal dose of sildenafil. That being said, there are serious side effects that have been reported from sildenafil that have included hearing loss, vision loss. Remember, they were developed as blood pressure meds. They drop your blood pressure. And taking a really high dose can make you susceptible to fainting, dizziness, and that actually can be really dangerous if that happens at the wrong time, when you're driving a car or whatever.
Take medication as directed by your healthcare provider. Got it. So if we take anything away, we're gonna listen to our doctors. We're gonna listen to the smart people like Dr. Pete taking their time out to really give us this rundown on dosages. Thank you so much, Dr. Pete.
Yeah, it's my pleasure.
All right, and doctor's orders, you guys need to subscribe, comment, and follow for some more content. Thank you very much for watching.